Malaria Consortium is expected to award the subcontracts of at least $500,000 each to Johns Hopkins Program for International Education in Gynecology and Obstetrics, Infectious Disease Institute, Banyan Global, Deloitte Uganda, and the Communication for Development Uganda Foundation. The project will run until August 18, 2021. During this 5-year period, the program will reach more than 13 million Ugandans in 43 districts, 22 in the central area, 13 in Midwest, and 8 in West Nile, where malaria is most prevalent. The Malaria Action Program for District project aims to prevent and control malaria illnesses and deaths in order to minimize the socio-economic effects of the disease. These efforts will ultimately contribute to reducing deaths due to malaria among the overall population of the country, especially in children under 5 years of age. The project's objectives include preventive measures such as providing insecticide-treated nets for universal, routine coverage and multiple doses of sulfadoxine primethamine for intermittent prevention of malaria in pregnancy. It will also improve diagnosis and treatment, which will allow at least 85% of people with uncomplicated malaria to be treated with artemisinin-based combination therapies within 24 hours of the onset of symptoms. In addition, the project will create an enabling environment for the implementation of key malaria interventions. Malaria is Uganda's single greatest killer. In 2013, there were 3,631,939 confirmed malaria cases and 5,921 reported deaths in Uganda. That's according to the World Health Organization Malaria Report dated December 2015. Malaria also imposes a heavy economic burden. A single episode of malaria costs a family an average of $9. A 1% increase in malaria morbidity or illness reduces GDP by 0.178% per year, and malaria drains $658 million from Uganda annually. The annual direct cost of malaria treatment is a staggering $41.6 million, and the average number of productive days lost for an episode of malaria is 8.4 days.